Hello and welcome to SLP Full Disclosure. I am your host, Jennifer Martin, and joining me today is an amazing guest, Jenny Traver. Before we get started, I want to remind you about our sponsor, and we are sponsored by AMN Passport. We all know that life can get busy, and that is why AMN created Travel Healthcare's highest rated mobile app that helps you to find, book, and manage your next healthcare assignment all from the palm of your hand. AMN Passport puts you on the fast track to your next travel job, so receive instant job match notifications when you download AMN Passport app today. And now on to our episode with Jenny Traver. Today we are going to talk about the role of the SLP in concussion management. And let me tell you a little bit about Jenny before we get started, because she's got a very impressive background. So Jenny Traver is a speech-language pathologist and certified brain injury specialist. She owns a private practice called Cognitive-SLP in Boston, Massachusetts, and she specializes in virtual cognitive therapy and executive function coaching for children and adults. Jenny uses a holistic and person-centered approach by combining traditional cognitive-linguistic therapy with metacognitive strategies, mindfulness practices, and growth mindset coaching to improve the client's well-being and quality of life. Jenny has clinical experience. She's done inpatient rehab, outpatient clinical, and teaches graduate students at Emerson College. In 2022, Jenny received the Distinguished Early Career Professional Award from ASHA. And lastly, she completed her undergraduate degree in philosophy and education at the University of Notre Dame and her master's in speech-language pathology from Massachusetts General Hospital Institute of Health Professions. Welcome, Jenny.
Thank you so much, Jennifer. It's wonderful to be here with you.
Yes, it sounds like you have been busy the last several years. I'm like that. My bio doesn't look like that. So you've definitely been busy doing all sorts of really cool things within this profession.
Well, thank you. I was lucky to find my passion early on in my career. And once I found how much cognitive therapy and brain injury rehab lit me up, I knew I had to go full speed ahead and learn as much as I can to help all of those.
Well, let's dive into that. I always love to just find out from guests what led you to become a speech pathologist, and even then to go into this field that you're currently in, or to specialize in the area you're specializing in now.
Absolutely. So my initial spark with speech-language pathology was actually back in middle school when I worked with an SLP myself and saw just how much of an impact someone could make on a child's life. And it was always in the back of my head. As I continued my studies, I went on to Notre Dame to study psychology, actually, and education, and kept thinking about speech-language pathology, although we didn't have the prerequisite courses at my school. So I studied psychology and education and then moved to Boston and began studying at Mass General Hospital's graduate program. And that was where I dove more into the medical side of speech-language pathology and completed my concentration in medical SLP and had a placement at Spaulding Rehab in their inpatient pediatric program. And there I was working with children as young as 2 weeks old through around age 22 across the spectrum of our SLP scope of practice, which is wide. And yet I quickly found that my interests were with cognitive therapy and cognitive rehab in particular, helping children regain their ability to pay attention, to remember things, to plan, organize themselves with the goal of getting back to school. So a large part of my time at Spaulding was on helping students not only return home, but return to school and communicate with the school about what accommodations they might need now, what our trajectory looks like going forward in terms of their recovery timeline, and helping to bridge that gap between the medical world and the educational system. And during my time at Spaulding, my team, I worked on an interprofessional team. We had PTs, OTs on our rehab team. We had nurses, doctors, social workers, counselors, child life specialists. And at times when we'd all come together before discharging a client, we would struggle to find the appropriate services for ongoing cognitive rehab, especially services that provided functional rehab, that understood the school reentry piece, that were able to provide the ongoing education and counseling for our families. So a few years ago, I left the hospital and started my own practice with the goal of bridging this gap between the medical system and the school system, and helping families transition home from the hospital and back to doing the things they love, helping kids and adults get back to work, back to school, and back to their daily activities. And that's what I've been doing for the last few years. I've transitioned from going into people's homes to now being all virtual therapy, and which many have done in the last few years with COVID. And I found that that's been allowing more families to work with me, allowing us to see even more carryover of skills, being in their own environments, in their own space at home, and helping our kids feel a little bit more independence as well, when not needing to rely on parents or caregivers to transfer them or transport them to therapy activities, being able to sign on from their own space, from their own room, create some more of that comfort as well. So now I've shifted from more of the moderate to severe brain injury to concussions in the last few years as well, and mild to moderate brain injury. Given, as many of us know, about 80 to 90% of traumatic brain injuries are those mild TBIs and concussions. So there's a lot more people that are needing our support, and not all of them end up in the hospital system. Some of them go directly back to school. Some of them bump their heads and have a short fall and don't really get any services, don't get it checked out until weeks later, when all of a sudden the headaches are happening or they're feeling dizzy and they don't know why. So that's where my passion lies right now, is to help spread that awareness and education about how we can make a difference in concussion care, how we can act early, and of course the role that the SLP can play to support these students and adults recovering from concussion.
I feel like you just told such a beautiful story of the start to this. It's been this very beautiful trajectory to where you are now. And I love, it sounds like you've always had that love of that, your brain, how people think, and then being able to combine that with the speech pathology. I always just love those moments where it's like, oh, things come together, and you probably didn't plan it that way, but what a beautiful pairing. And that job at Spalding sounds really cool. And probably, I can't imagine that you did not learn a ton. Again, not only just within your own discipline, but how all the other disciplines work together, and how important it is that each person, doesn't stay in their silo, but works together. So,
Absolutely.
Yeah.
That collaboration, I certainly took my experience on an interprofessional team and bring it into my practice. In terms of how often I'm looking to collaborate with others, I think that's one of the things that's different about my practice, is that I'm often in communication, not only with the families and the caregivers, but with their school team, with the learning specialists, with the SLP at the school, talking with the school nurses at times, or the athletic trainers, but also collaborating with the medical team if they are seeing other rehab professionals or even their primary care doctor, to make sure we're all on the same page, because that's when we can really make the progress that each person deserves, is when we're all communicating and leaning into our skill set, but also then sharing what we know and our observations with each other. So I completely agree with you, Jennifer.
Yeah, I love and agree with everything you just said. I say to parents and other professionals all the time, progress doesn't happen when I take them for 30 minutes once a week by myself and then say, okay, now off you go. It's like, then what happens the rest of the time? outside of that 30 minutes, right? So I love that. And I think it is I love that you're also bridging that gap between the medical and the schools, because I think sometimes too, people think, well, this is outpatient, this is medical, or this is educational. But what you're doing is no, they are related completely, especially in this population that you're working with that are in school. That's basically their job for the next however many years.
Absolutely. And I think, one of the reasons why this was so important to me initially when I started my practice was to create this sense of collaboration from the beginning, was because the research shows us that the collaboration between the medical and the educational systems is what creates success for this child long term and helps them achieve their overall learning potential. And when we don't have this communication, we see that their needs aren't met long term. We see that they, these difficulties with learning pop up later on, and we're not quite sure why. And I think being able to address them earlier and make sure we're on the same page, communicate with the school, let them know what's going on, putting it in the school record even. Something as simple as making sure we know that the concussion or the TBI is documented, especially if the concussion does not happen on site. If the concussion is happening at home, we want to make sure that we're letting the school know. We want to make sure that the school is informed and that they can support us in tracking what's happening, what symptoms are occurring, and what their progress looks like.
Yeah. Well, and we're going to dive into more of just the world of concussions. If you ever write a book, Jenny, that's your autobiography, The World of Concussions. There's your title. But I first want to ask also, because I know this was newer to me and probably to many of our listeners, what is a certified brain injury specialist, and what were the steps you took to get that certification?
Great question. So the CBIS, the Certified Brain Injury Specialist, is a certificate from the Brain Injury Association of America. And it's really a way to highlight your experience with working with individuals with brain injury, but also make sure that you have the most up-to-date information about the scope of brain injury prevention and rehabilitation. So in order to apply to become a CBIS, you first need at least 500 hours of experience working with individuals with brain injury. Then you need to demonstrate your knowledge of this full scope of brain injury prevention and rehab by studying and passing a certification exam. And then you also show your commitment to the current research and ongoing education by completing at least 10 hours of continuing education beyond that first year. So it's really, I think the CBIS highlights somebody's knowledge and experience working with individuals with TBI and allows us to provide more specialized care for our clients, helping them feel comfortable that they're not the only person we've seen with a TBI, that we have an understanding of how the brain injury can affect you, not only cognitively, not only with your communication, but more holistically, how it can affect you emotionally, how it might affect you financially, and physically, and how all of this plays a role in getting you back to your life.
Yeah, it also shows that you have dedication, because it's not like, oh, I'm going to take a weekend course. So it sounds like, I'm so glad you're sharing this information, because that it isn't something where you can say, I want to go get the certification and then start working with this population. You have to have that 500 hours already working with this population to then go get the certification, correct?
Yes.
Okay.
Yes.
Okay. So
you start with the hands-on care, and then you take this exam to, again, show show the full picture of brain injury so that we're not just understanding the SLP role, but really identifying the interprofessional components of brain injury and how to support our client and connect them to resources longer term.
Yeah. And going back to even that, if you think about, well, I think as SLPs, we often think, okay, I always say we work from everything from here, from this place, from the neck up. But you're right. It's the brain controls everything. So it's also, like you said, looking at emotions and physical and coordination and fine motor and gross motor. Yeah. So I love that it is so holistic, because I think that would be doing a disservice if it wasn't, because you really can't, you have to look at all of that, because the brain impacts every single bit of that.
Absolutely. And I know you highlighted the mental health component in particular. And, that's one thing, especially with concussions, keeping an eye on somebody's mindset around their recovery is huge, because their mindset about their brain injury and about their recovery process actually impacts their overall recovery.
Yeah.
The timeline. And there's more research coming out that's supporting this, and how beneficial it is for us to help the individual understand what it means when you have a brain injury and how this impacts your system, and that many of the symptoms they're feeling will improve, but we need to give it that time. We need to give it the time and the care and the attention that it needs, and not overdo it now, or we might see these setbacks along the way.
Yeah, I love that you bring that up, because being a kid, a teenager, it's hard when things are going well. There's a lot of chemicals and hormones and emotions. And so you add anything that isn't expected that can cause challenges. And then, I'm sure that is a huge piece of it, because it's hard. Adolescence, and it's hard on a good day. And so, well, and okay, so it sounds like when you were at Spalding, you were working more with, it sounds like severe TBIs. So I'm assuming, more severe accidents, automobile accidents, falls. Would that be in line with more of what you were working with before moving to concussion?
So I would say at Spalding, I was seeing a range from mild to severe.
Okay.
However, as you can imagine, I was in the inpatient rehab facility. So for someone to qualify for inpatient rehab services, they are stabilized from the acute care facility from a medical perspective, but still need 3 hours of therapy per day, including an hour of SLP. And I think, so just to give you all a picture of how much more intensive the therapy was, often I was working with individuals that were emerging from a coma, that were, relearning to talk, pay attention for a few minutes, and relearning how to remember things, and that orientation piece at first. And those individuals would stay with us for much longer, perhaps, 2 months or several months at a time. Whereas the individuals with mild brain injury might come with us just for a week if they need intensive care, but then they can transition home as soon as they can and work on getting back to daily activities. So it was a wide variety that I saw, just given the nature of the facility and what supports the individual needed.
So, and it sounds like, and you mentioned this earlier, that they were getting a lot of, you can see, you've had a car accident, you fell off your skateboard, you've got a head wound, it's very visible what's going on. It sounds like some of your drive to move to the concussion road and is that it was like, oh, you can't see anything. And okay, well, you're doing fine now. And then a week later going home. And then, like you said, then these issues start popping up down the road. Is that what led you to move from more of, or one of the reasons to more from that more severe to more of the concussion realm?
It's a good question. I would say One of the big reasons I've been seeing more mild TBI and concussions is because they're not receiving as much care as those who have more severe brain injuries. So a part of that is what you're getting at, this idea that there's more physically going on, they're more complex in nature, so they receive intensive medical care as a result. But the other piece is, individuals with concussions might not go to the emergency room if their symptoms are not that severe initially.
Yeah.
Hopefully they go and see their PCP to get a full checkup, but some don't. Some people might just go back to school. I mean, think about how often this happens to so many people. As I share what the work that I do, I've been learning more and more from others, saying years ago, oh yeah, I remember when I fell and hit my head and I felt a little weird for a couple days, but then I was fine. Or, yeah, my kid fell off the monkey bars, but she went right back to class and everything was okay. She had a bruise, but everything was fine. So I think, all of these components of falling and not necessarily getting the care that we need immediately, because it is invisible, as you're saying, because the symptoms might not show up right away, means that down the road, we might see new symptoms arise, especially at moments when the demands of our environment are increasing, right? So that might mean once the kid might seem fine initially, but once they get back to school, it's like, whoa, all of a sudden headaches are coming up. They're tired all the time. They need to take naps when they get home from school. That might be showing up. Or, we might see they're fine in school now, but then as soon as finals come, right? Final schedule is happening right now for many students. And then the idea that they need to plan and organize all their final projects and studying for their exams, all of a sudden these executive functioning difficulties come up because the tasks themselves are more cognitively demanding. And I think that's where we often see the invisible part of the injury is the cognitive component, right? There's so many symptoms that result from a concussion. But to your point, we often treat the physical components and we might not realize the cognitive components until school is affected, we're stressed out at school, grades start to decline, teachers start noticing that their participation has varied. And then the question comes, well, what do we do? Right? And certainly that's when we want an SLP involved. That's when we want to get more care. But ideally, it's happening before then, right? Ideally, we're shifting the narrative to say SLP should be on the team from the beginning. You go and get physical therapy, you should also get an evaluation of their cognition and see if they need ongoing supports. See what other accommodations we could put in place, even if it's temporary. Right? And build that interprofessional team longer term.
Yeah. And I think it's so critical too. You don't know what you don't know. So a parent or a child may not know, hey, these are things that you may see. And this is, if that happens, here's how we're going to work with it. Because if you don't have those discussions and all of a sudden I've moved from elementary to school to middle school where I've got to change classes every day and keep track of all this. And now I'm a complete mess and I can't keep up. It's like, oh, well, if we had talked about it and said, hey, these are some things, then it may have made that transition smoother and put some safety, some guardrails in place.
Absolutely. And, again, remembering for our students and the pediatric brain injury component is that their brains are still developing. And because of that, they might not have as deeply rooted pathways in their brain for certain things. And as they continue to develop, we might see that there's new difficulties arising. And that might be, it could be weeks, it could be months, it could be years, as you're alluding to later. And again, circling back to what we said earlier, it's so important for us to notify the school and have it in the school record that there was a concussion, and making sure that the team is aware that we want to check all of these points. And if there is a big transition happening, if there's new difficulties arising, to have that conversation with our team to say, could this be related to the concussion? And now what do we do, right? And now where do we go from here?
Yes, great point. Okay, so just so we all have our definitions correct, I want to dive into what is the definition of a concussion. But first, does concussion fall under the TBI umbrella or are they separate?
Great question. A concussion is a mild traumatic brain injury.
Okay.
So concussions do fall under the umbrella of traumatic brain injury. And, I think it's tough because thankfully in the last few years, there's been more of a push for us to use mild traumatic brain injury and make this connection for people. But I think it really helps for us to take the concussions more seriously. I've heard a lot of people say it's just a concussion or it's just whiplash. It's just a mild TBI. And even though it's mild, there can be really severe symptoms that result from this. So making sure that we understand that it is a blow to the brain, right? So when we think about the definition, as you said, I like the CDC's, the Center for Disease Control and Prevention's definition, which talks about how the mild TBI is a bump, blow, or jolt to the head that ends up causing the brain to rapidly move back and forth. And the sudden movement is what causes the brain to either bounce or twist and creates chemical changes in the brain that can stretch the brain cells and ultimately damage the brain cells. And I like this because it talks about, one, that it is the mild TBI, but that it can also be the bump, blow, or even a jolt to the brain, right? So it's not always falling down that causes a concussion. It could just be that whiplash. It could be the rapid acceleration and deceleration of the brain that can cause a concussion, and that there is chemical changes that are occurring in the body as a result. And as the brain is really dealing with this energy crisis, more resources are going to the brain, so the body is more fatigued. And we need to give it that time to heal, to really get back to where we were before.
Okay, that explains so much about why that fatigue is such a part of it, because your energy, your body's so smart that it knows, okay, every bit of our resources need to go to this part right now. And I also really, because I do think that I think most often about something hits you in the head, you fall. There's got to be something very abrupt, but you're right, it can be. And I'm thinking of, these electric scooters and things where it's the acceleration, deceleration, things that it could even cause something like that. And it sounds like it's hard to diagnose because, or is it hard to diagnose?
It can be. And I think this is where I always recommend that you go and see your primary care physician to do a full workup, and to ask them for, who they would recommend to be involved in the team. Yeah. Because ideally we would get a physical therapist and a cognitive therapist involved early on so that we can begin that education, begin the management of symptoms, and then work towards the, returning to school and activities. So that education piece is really key at the beginning. But often what you'll see is, the most common symptoms can be divided into four main categories following a concussion. We have the physical symptoms like the headaches, the lightheadedness, the dizziness, the neck pain that you might get, nausea, blurry vision. The cognitive symptoms, which is more of our SLP realm, which are the memory issues, concentration difficulties, brain fog. We've been hearing more about with COVID. Brain fog is common. Feeling slowed down or having trouble finding the right words, difficulty making decisions or planning. The emotional piece is huge too. Increased sadness, irritability, anxiety, depression, mood swings in general, rapid shifts in moods without really any change in the environment. And then sleep. So difficulty falling asleep, staying asleep, sleeping more than usual, or even falling asleep at inappropriate times throughout the day. So I think keeping an eye on those main categories initially is what's really helpful for people to start tracking. I have a handout that you can, if you go to my website, which we can share with
Yes,
the listeners.
we'll put it all in the show notes.
Awesome. There is a handout I created for individuals with these 4 categories so they can easily go through and circle which ones are coming up for them and use it as a way to track what's happening, at least early on, to share it with their primary care physician, to share it with their teachers and the school nurse and athletic trainers to understand, who do we need to get involved? Who needs to be part of the team? And it's really that initial trigger of, if there are a few cognitive components that are being highlighted, that's when we want to start thinking about our SLP colleagues.
Yeah, and we will definitely link all that in the notes, because I think that's such an important resource. And I'm thinking too that anybody, whether you are a parent listening or have children in your life in some way, or so many of us work with children. And so if a child comes in on Monday and you say, "How was your weekend?" They say, "Oh, I fell off my bike." And I mean, sometimes we may be the ones who are hearing the information for the first time, where it's like, "Oh, okay, we probably need to, I need to give your mom a call or somebody and make sure that they know about this," because you're right. A kid could probably think, "Oh, it's just a bad fall, get up," and then go about their business.
Mm-hmm. Mm-hmm.
So,
and it happens so often. It happens so often for all of us. I mean, everyone listening, think about the last time that you fell. Did you see a doctor about it? Think about the last time you tripped over the kid toys, or you ran into the side of the table, or, like you opened the door and you had a bump and you felt a little weird, but you didn't see anyone about it. So I think, it happens more often than we really realize.
Yeah, I have 2 adult friends of mine, and one was playing just rec softball. It was hit in the head and it really just changed the course of her life in some ways. And it wasn't even, what you would look at where you see these professional baseball games where you see them and they're down. It was more of, and then another friend with a pretty mild car accident, but it changed the course of even her professional path, because her job was so based in doing math and working. She worked for a large oil and gas company, and math was a critical part of her job. And she had to change jobs because she said, "I can't do math the same way." It was really, So, and I know that's another, I'll get us back on track, but it was just, I'm thinking as you're talking that you're right. There's so many opportunities for us to have this happen. So for going back to your role, what would you say, when are most kids, or when are you getting most of your referrals, at what age for concussions, and how are most of them acquired, if you can even pinpoint that?
So I would say I'll answer this in 2 parts. One is according to the research, and then I'll share a little bit more about what I've seen in my practice. So to take a step back, the research says that the most common causes of TBI are falls. We've talked a bit about, but especially for those younger kids, falls are most common. Or toddlers think about how much they're moving around and falling and playing on the playground and falling. And and then also our older adults, we tend to see more falls as well, being the cause. We also have more motor vehicle accidents, right? Car accidents. And that we can see a tick more in the teenage years, adolescents, when they're learning how to drive. And same with sports injuries. We see a huge tick with more organized sports, which occur more in the middle and high school age and adolescence. I think one thing that's interesting is that often people assume that the concussion is due to a sports injury, meaning that the majority of concussions are caused by sports injuries and the rest are just, little bumps that we don't care about. When actually recent research has shown that more than 1/3 of concussions in adolescents are not due to sports injuries. And I just mention this because I want to make sure that, individuals who aren't in organized sports also understand that this applies to you, and
Yes.
that we don't want to leave out this whole group of people that might not get as specialized care in the schools with their coaches and their teammates and the athletic trainers that might keep a closer eye on the student athletes. So just a quick note about that. In my work, I do see a lot of falls and sports injuries. I've seen some car accidents and even just like rear endings. And often I'm seeing individuals a couple weeks after their injury to start that initial education piece and discussion around getting back to school and what accommodations we need in place and how the school reentry process is going. And then certainly after that month mark, I'm seeing more people come in with longer term symptoms. And that's where we can do more of our work around the cognitive strategies and adjusting the accommodations to support what their needs are.
Yeah, and thanks for calling that out, that sports is a part of it, because I do think that is an area where most of us our minds go to that. But you're right, there's so many more opportunities for us to get a concussion just in our daily life. So what is the average age when they come to you, of your clients?
So I
Or
work
is it just so varied?
it is varied. I now work with school-age children and adults, so anywhere from around 8 years old until 65.
Oh, wow.
But I see a lot of high schoolers with concussions, which makes sense from what I shared. The research shows, right, that there's more of the motor vehicle accidents, more of the sports injuries. It's also more of a demanding environment, right? So sometimes I will see someone who has a concussion as a high schooler, and they're seeking my support after this concussion, but they've actually had a few earlier on. But now is when they can't keep up with the changing of classes, as you mentioned earlier, the management of their final schedule, all the many requirements that we ask of our high schoolers to manage on their own.
Yes. And I want to get into the assessment and treatment process, which I know we could do a 2-day workshop on, but just an overview. But one thing I do want to mention before that is I have heard multiple stories at this point of, and the reason I bring this up is like thinking of the signs and symptoms as an SLP or somebody that works closely with youth, is that I know that sometimes they will be feeling these signs and symptoms, but won't say anything because it would keep them from being able to continue to play that sport. And that is something I've also been hearing. And so that I think is so important for us to be able to say, they may not come forward at risk of being pulled, but if we recognize, hey, something else is going on, advocating for that is something else I've just recently been hearing about. And I'm thinking, oh no, that's not good.
Yes, I'm glad you brought that up, Jennifer. There are a lot of challenges in terms of students self-reporting their symptoms and wanting to get back to sports and activities sooner. I've worked with a lot of people who want to get back to class sooner. They love being a student, and they're annoyed that they can't do it all and they need to keep taking breaks. And that's again where the education and the counseling piece comes in to help them understand that, this is what your body needs. Your body is still healing. Your body is working so hard to give your brain that extra support right now to heal, that it is more fatigued. And these activities are going to take a lot longer and are going to be more effortful just for now, right? Just for now. And if we put these systems in place, we will see progress. And I think that, making sure the families understand that the symptoms might not be reported appropriately. Also think about our younger kids. They might not even know really anyone.
Great point.
The younger kids might not know what's included. They might not be able to communicate what's happening to them or have the right language to explain what they're feeling. But even the older kids, they sometimes these symptoms can be misconstrued as part of something else that's going on. And I think that's where, again, being able to take a step back and provide the education is where I've seen the biggest benefit. To have more of those aha moments with the students being like, oh, that's related to my concussion? I never thought about that. I thought school was just harder all of a sudden, or I thought I was tired today. Like, that's probably because your brain is recovering. So that can be a big
Well, yeah. And then that helps them. We all feel better knowing there's a reason for what's happening inside of us that feels like, oh, it's because of this. And, then it doesn't cause a chain reaction of other negative feelings. And I want to touch on, and I know this probably looks different, whether you're 8 or 65, but what is just kind of a general assessment process when you get a new client? And then how does that drive your goals and treatment?
So I think the biggest thing is to understand, the first step is to really understand what the client's concerns are, right? What they are noticing as being the biggest symptoms and the biggest challenges in their daily life. And of course, getting the family and caregiver's perspective as well. Also understanding the background information. What I mean by that is, do they have another history of concussions? What happened with those concussions? Did they receive any rehab? Did they see a doctor? Are there any other pre-existing risk factors that could be indicative of prolonged recovery? Things like prior learning differences, a history of anxiety and depression. Also the history of concussions can be a part of that. Understanding what happened with this concussion so that we understand the mechanism, right? Was it the acceleration, deceleration? Was there any twisting of the brain that occurred? What part of the brain hit the ground or was hit by a ball or a bat? I think is helpful as we gather our information and understanding where the school is right now. So what type of student was this person beforehand is really helpful. Were there any accommodations or supports in place? And what is happening with the school right now? What communication has happened? Have any accommodations been put in place since the concussion? Are there current challenges that the student feels with certain classes and what's going on there? So I think exploring the current situation and some of the history is the first step. Next, we want to look more at, a whole picture of the person, right? So we want to understand what cognitive and communication deficits are present by looking closely at the hierarchy of cognitive skills. So looking at their attention, their memory, their executive functioning, their self-management, understanding what challenges are arising in the classroom and starting to piece together why that might be the case. And making sure, I think an important piece for me is making sure I understand what their understanding of their injury is, right? How much they understand the concussion and what's happening in the brain right now, and how much additional support they might need with that regard. And then I want to look at a multi-system approach to see if there are any other concerns that I have, and I might screen for some of these to see if other professionals should be involved, right? So looking for those red flags that maybe we do need mental health involved, or no one's really checked on the vestibular physical therapy, but there's clearly some balance issues. Let's reach out to a vestibular PT. Or the neck component, the cervical component seems to really be causing some of these headaches. Let's get a physical therapist who's involved with the cervical, trained in the neck. And I think that's another piece, especially early on, that we can help with is identifying what other team members would be helpful to get on the team now.
Well, and you bring up such an important point because even I was asking you that question, I'm thinking, well, of course you'd want to figure out what's going on now, but all of that background information is so critical. And if you don't have that, then how do you plan? How do you know what's different? Right. And so it was one of those like, of course, but it just didn't immediately dawn on me. So it sounds like for assessment, it's where were we? What were we doing? Who were we? Where are we now? And what's being affected? And then do you work with them to figure out, okay, here's where we know that where you were, where you are, what's challenging. And then do you make those goals based on what they deem most important, or how do you determine the goals based on once you have that baseline information?
So thank you for mentioning that. That's the last piece of the assessment, is what their goals are. And it's a discussion about what, challenges they've seen, what they want to get better at. And then I'll use some patient reported outcome measures to help us dive more into what's going on with their cognition and help them to create these goals collaboratively, right? To identify what specifically would be supportive for them, what strategies they want to learn, how they want to show up in the world, and then we'll create the goals together. But often the goals are, I'm sure you can glean from our conversation so far what some of these categories are, but I'll highlight them as well. The first would be around the education piece, right? Brain health and psychoeducation. Is there any additional information that we need for brain health or about concussions that we want to start with? That's always my first question. Then I'm going to be looking more at the symptoms and managing of symptoms and managing their energy, which is a big piece. We mentioned earlier that fatigue is huge. So, understanding what other supports they might need to manage their energy. Then we'll be looking more at that cognitive hierarchy to see if there's specific strategies that they might benefit from to strengthen their cognitive skills and improve their attention, memory, and executive functioning. And the third piece, the final piece, is looking more at the school. So often, whether it's school or work for my older individuals, working on identifying what additional supports we need to help them succeed. So that's kind of a high level view of what I look at.
Yeah. No, and I think that probably helps tremendously to have those categories and know, okay, we know this is what's where we are, what's important to you, and then let's look at those categories and see what we need to prioritize in each of those categories. And I'm thinking too that when working with concussion, is it such that while the brain is healing and doing what it needs to, are many of those goals based on compensatory strategies to help them overcome some of those roadblocks while the healing is taking place? Or is it just, is there anything that we can actually do other than, resting, taking care of ourselves, doing things from a health perspective that can heal that concussion?
So I think the biggest piece early on is going to be the education.
Okay.
And supporting the education piece and the counseling piece, and helping with the symptom management and energy management, as I mentioned. Depending on where we are with the school, we might start to do some of those additional strategies as well. But a lot of the work with the strategy instruction comes more longer term for those with persistent concussion syndrome.
Gotcha.
And ongoing symptoms, because early on, it really is more, as you mentioned, it's more about allowing the brain to heal and making sure we're not overdoing it early on. We're not surpassing the symptoms where then we need to cut back. And that we're supporting, again, that the whole person. So helping them validate and normalize their feelings and feeling like they have the right people on their team. If that makes sense.
Yeah, I'm sure it just brings so much relief when you're saying, yeah, this is we would expect that you would have blank, blank, blank. And it's like, oh my gosh, I'm not losing my mind. Like, this is real. So, and one more question about treatment, because I know, again, and then I want to definitely direct people to because there is so much information that, I mean, we just dipped a tiny little toe in the water. But I know that it used to be, and I'm assuming it's still the same, that limiting screens was a huge part of recovery. Is that still the case? And if so, how do you do that in this day and age when everything is on screens?
Great question. So yes and no. I would say initially that first 24 to 48 hour period, we are really trying to maximize rest, minimize screen use, and focus on just letting the body do that initial healing. After that, though, like many things, we've shifted away from saying don't do them, but to do them in moderation. And when to bring that awareness into when, for each individual, when you start to notice the symptoms arise, especially after you've hit what I call the 2 points. So it's if you go up if your symptoms increase by 2 points on a 0 to 10 scale, that's when we want to take the break. That's when we want to do something to change so that we don't overdo it. But so after that initial period, screens are okay, but we want to monitor your own symptoms. And we also want to find ways to not overdo it. As you said, in the classrooms, I just was working with an individual whose whole school day is on screens. So we had to find ways to print out some of the notes or, work collaboratively with another classmate. So they're on the screen, but we're just talking and they do the typing or they do what's on the screen. So finding creative ways to support the student in the classroom, I think is again part of our role in identifying what those accommodations could be in the classroom. And again, I'll just say, another reason why SLPs are so critical to the concussion management team is that we're not only highly knowledgeable about the brain and about cognition and communication, but we're also skilled in understanding how deficits in cognition and communication can impact a child's learning. And I think that's where our skill set helps us identify and adjust accommodations. So I'm such a big proponent of having the SLPs in the school join the concussion management team. And I love when I get to work with an SLP in the school so that we can both collaborate and share what we're seeing. But I think all SLPs that are listening that are in the schools, making sure you advocate for yourself and, let people know how important it is, how your knowledge does help and how your training is perfect for supporting someone with a concussion and highlighting how the cognitive components are key, right? To circle back to some of our earlier conversation, that concussions are not just about the physical symptoms, but there are a lot of cognitive symptoms in those four main categories that we had: physical, cognitive, emotional, and sleep. The cognitive piece is huge, and our knowledge of counseling and supporting individuals also supports that, the mental health piece. So again, I think that handout that I mentioned that's on my website is another way that we can explain to individuals in the schools and our teams why we should be involved, that this cognitive intolerance piece, which is a relatively new term that's coming out in the literature, highlighting the role of cognitive therapy and not overdoing it cognitively. Since so many people, I think there was a study in 2014 that showed almost 75% of individuals with concussions needed accommodations in school afterwards. So I could talk more and more about this. You can see that I'm quite passionate, but I wanted to make sure I added that in before our conversation ended today.
No, and I'm so glad you did, because I do want it really, when you're saying that, who better than SLP? I mean, really, it's like we are trained in all of those things. And so I love that you point that out, that it is definitely, that's within our scope, big time. So, okay. So Jenny, you, like I said, you are just a wealth of information. We want to direct people back to your website, and that will be in the show notes. And what else? I mean, if they, going to your website, there's obviously resources, information. And if somebody, because you are doing this work virtually, that would also, I'm assuming, give people a place where if there was a referral that they felt like, oh my gosh, this is, whether for a child in their life or a child they work with, is that also a place where they can do that as well?
Absolutely. Absolutely. You can reach me at my website, cognitive-slp.com. I'm also on social media, on Instagram at cognitive-SLP. And I will say, one thing that I'm also quite passionate about is finding more ways to spread this awareness and education around concussions and what we can do to support someone in their concussion recovery early on. So I do have some additional education series coming up this fall for parents and caregivers, and anyone can join those groups as well. So certainly reach out. I'm happy to answer any questions or support you all in however I can.
Yes, we will put all of your website, your social media, ways to contact you, because I have learned so much in this conversation, and you've really debunked a lot of things that all this time I thought, oh, it's this, but no, it's actually that. And knowledge is power. And when we know better, we're able to help, we do better, and we're able to help the people that we're working with. So Jenny, thank you so much for your passion in this area and for your willingness to just, and passion to spread the word about this. And thank you so much.
It's my absolute pleasure. Thank you for inviting me to be on the podcast.
And that wraps up this episode. Thank you for tuning into SLP Full Disclosure. For more information about this episode, check out the show notes on our website at medtravelers.com/SLP Full Disclosure. And don't forget to leave us a review and subscribe so you never miss a guest. Are you interested in becoming a travel SLP? Visit medtravelers.com to learn more and explore the exciting opportunities we offer at top-level facilities across the country. Also, a special thanks to Jonathan Carey for producing this episode and Aiden Dykes for the music and editing. And as always, this episode was powered by Med Travelers. See you next time.